This interview is sponsored by Metagenics. At Metagenics, they recognise the value of great health and the trust the patients place in their healthcare practitioners. Their commitment is unwavering in assisting practitioners to provide exceptional healthcare solutions and empowering you with the confidence to prescribe Metagenics so your patients can benefit from solutions they'll truly appreciate and rely on. Hi, I'm Natalie from ATMS. Welcome to our presenter Spotlight. In September, ATMS have their post-viral symposium where 5 leaders in their field will be presenting on this important topic. And today I'm joined by Carla Wrenn. Carla is an integrative naturopath and nutritionist and has been practicing for over 22 years. Carla has gone on to do many postgraduate studies as well in integrative oncology, autoimmune disease, and functional medicine. And she has a clinic at Peninsula Herbal Dispensary and also a brand new clinic over the last couple of years, which is called Long COVID Care. Hello and welcome, Carla.
Hi, thanks for having me.
You seem to be doing so much and over the last 22 years. Congratulations.
Thank you so much. It's been fun.
I bet it has been fun. So if you want to give us a bit of a, brief intro to yourself and how did you get, into this area of not only naturopathy, but then really deep diving into post-viral illness as well?
Yeah, so I guess when I studied to be a naturopath and came out of college, I was only 21 or 22. So there was a long period of time where I worked in kind of general practice. I did the health food stores. I was lucky enough to be able to work at the Peninsula Herbal Dispensary before I owned it. And I was really looking for an area that inspired me. And I really started to attract a lot of the complex cases. And then I put on my business card, I love the complex cases, which I'm not sure if it's a great thing to do or not, but it certainly made me really busy. I use the term invisible illness a lot, and I really tried to attract the people that just didn't have solutions for their health problems and were really struggling to find the care they wanted. And so I guess that has extended out to things like oncology and autoimmune disease, and more recently post-viral illness. Coming from Melbourne, what was happening in 2020 and 2021, 22 was all really in my face and in my patients' lives. And as I started to see patients developing a post-viral illness, I really deep dived into the research to see, well, what can I do? And I think looking at the experience of treating some people with chronic fatigue syndrome, as most practitioners have, or other post-viral illnesses, and the research that was starting to coming out and know about the amazing tools we had, it was just kind of a natural direction. And I really wanted to be able to say to people who everyone saw people on social media or in the media saying, they didn't know what to do. And I was like, hey, we've got some things we can try. And it really just came from there. And I decided to create Long COVID Care just to keep those patients in a system that was really great for them. I set it up virtually because anyone who's seen patients with post-viral syndromes know they might be in bed while they're consulting, and to get to a clinic consultation can be a lot. But also I started to really use some very focused intake forms with lots of very specific questionnaires associated with post-viral and long COVID kind of conditions, and really repeat those questionnaires each time I saw the patient to get a really good understanding of what was happening and what was improving them.
So, and I know research is a big thing for you. I see you doing lots of research all the time. And so what are some of the outcomes or the main areas of focus that you have found for post-viral illness or long COVID?
Yeah, so I really tried to go with the angles that I'd learned at functional medicine, which is really to try and I guess it's, old school naturopathy as well, like trying to discover the drivers. So for me, it's about pulling apart a case. And for functional medicine, I'm always thinking in puzzle pieces or mosaic pieces, and really to be able to go, well, what can I pull out of the research? Our historical treatment of post-viral illness and what the patients are telling me they're experiencing or is important for them to understand their drivers. So for me, I'm looking at things like mitochondrial dysfunction and inflammation and HbA axis dysregulation and, post-viral or viral resistance or reoccurrence, a persistence, looking at, what is happening with all of those ACE receptors and just continuing on that pathway of research. So much has been learnt over time. And I think it would be very silly of someone to say now we don't know what causes long COVID or we don't know what to do for post-viral illness, because when you really pull all of those pieces together, we can create quite a succinct plan. And I love giving that to the patient, because quite often they've felt like there's no hope and no solutions. And pulling those pieces apart and understanding that really gives patients hope, and also gives us a great direction to be able to choose a handful of therapies that might be suitable for them to start to get them in the direction they want to go back to well-being.
That's so amazing. I guess sometimes this is the last hope for people, and they have been struggling for symptoms for sometimes months or years or whatever it might be, because someone might have a different viral infection years ago and still playing havoc. So I guess this is also slow but steady but linear as well in their progression. And if you found that supporting patients through that and connecting with them, especially as they can do it on Zoom, that's fantastic. So I think it's so important.
Yeah, definitely. And to be able to say, like, I talk to them about being a bit like an onion, and we've got to peel the layers off. And I try and determine what their area is the most challenging. And, if someone I spoke to a patient yesterday, actually, and she's having a hard time recovering. But for her, I think, she's got a young family. She has a really physical job. She's a Pilates instructor in quite a busy studio. So, school pickups and work, and she just can't get over that hurdle of getting back to her full-time job, because she really doesn't have time to rest. And that can be quite a different onion to peel to someone who has been able to maybe access some super or insurance to cover them while they can have some time off work and really rest and recover, and be able to spend more time doing things for themselves to get back on track. And maybe, like you said, they've had post-viral illness before, and certainly patients that have had EBV, glandular fever, Ross River fever, the list goes on. They are more challenging because there's kind of more layers to the onion to try and figure out what to do.
Absolutely. And so I guess with that deep dive into the research, what have you, experienced? It would have changed massively over the last 5 years, like 3 to 5 years would be huge for you. What areas would you see as emerging in the field?
Yeah, I think in the beginning I was just looking for any nutrition, any herb, and a couple of really great studies came out that got me going. I guess what I'm seeing more is a lot more details about neuroinflammation, really some big concerns about what's going to be happening cognitively for people over the longer period too. So we're not just thinking about how we can help patients now and get back to their lives and recover, but also what is going to be the fallout in 10 or more years' time. So that research is really starting to be quite interesting. I also think looking at the microbiome is becoming, even more of a detailed process. Microbiome is not my special interest area, but I certainly think we have to embrace that as we're helping patients improve. Look, every day something different comes out now, and it's just all adding pieces to that puzzle. And even as we sit here now, I think, well, what I'll be presenting in September will probably be different to what I know now. As I guess we're so lucky in that with our therapies really doing minimal harm. When a paper comes out that says, this looks good, I'm going to give it a go. And so there's, even if it's an early stage paper, but the logic behind those therapies fits and adds to our knowledge, then I think it's great that we can quickly start bringing these things into practice, and patients love that because they're just all about looking for solutions at this stage.
Absolutely. And I guess you do have a lot of contact with practitioners out there, and they're seeing patients obviously struggle. So what do you think would be the number one way that natural medicine practitioners can really make a difference with their patients with post-viral illness?
Yeah, great question. So I think there's a couple of things. I know you said the best way, but I have to say first, I'm
probably
really
many.
I think what we can add to this discussion that's happening between patients and healthcare practitioners is to give them hope. And I don't mean false hope. I mean that show them the research or explain to them, like I do a far more thorough care plan in my long COVID cases than I do even in my oncology cases, because I'm really trying to show them here's what we know and here's what we can do, because I think they've just been left in this kind of dark for such a long period of time with very little hope and lots of, perhaps gaslighting and, ignorance, anyway, so give them hope and really tell them you're going to stand there with them, because I think they're often felt very alone. The next thing is, I guess, to be really mindful about what's their aim and what they're looking for, because different patients are looking for different things. And I think try and address those strategies straight up, and, keep on top of the research and trying to, not on top of the research, that's my job, but we'll give them lots of info at the symposium, but just be confident with what you're doing, and reach out to practitioners like myself or supplement companies, tech departments, people that can help, because I think there is really a clear direction to go with these patients now, and we have so much to offer, and it can be a really nice support for patients, whether or not they've engaged in pharmaceuticals yet. It's still a really nice place for them to feel supported and heard.
And I think that's so fantastic, because we do collaborate as a profession and we do work together or come to each other for answers or questions and support and research. And as you said, the supplemental nutritional companies are a wealth of research as well. So I think that's such.
Sorry.
Go for it.
I want to do a timeline, because it's so important, like old school naturopathy, do a timeline. And they're important in functional medicine too, because like you said before, this may not be their first post-viral illness. And so very often the clues that really have helped me move patients further forward faster have been the fact that, I've been riddled with herpes, or I've had other instances where I know that I haven't rested and recovered well from other infections. Or we've actually found that they've probably got an arthritic or autoimmune rheumatoid kind of, there's some other immune challenge going on in the background. And hypermobility, that was another paper that came out recently. Patients with hypermobility are much more likely to suffer from long COVID. And so, ask those questions and get a bit of a timeline, because that can really give you some, gems on what to do with the patient.
Fantastic. And then do you utilize testing as well, and would recommend other practitioners to look at different testing for their patients?
Yeah, I don't normally do testing straight up, except for some blood tests. Like there's a list of blood tests that I'm really kind of passionate about doing. I do see things like B12 deficiency and iron deficiency really commonly amongst patients. So do what you would do for a normal patient in terms of a good workup to assess like what is happening for their immune system. I do ESR and ANA, and I always do the HbA1c. Some of the other things that can be happening in long COVID are things like, tendencies towards a development of a type 2 diabetes. So check those things a bit more broadly, because unfortunately it just doesn't seem to be happening with other healthcare practitioners. So get those tests done. Things like microbiome testing and further more progressive functional testing, I would normally leave till a little bit later. And I guess there's two reasons. In the first consultation, I'm really trying to empower them with things we can do now. They've often waited a long time or been to lots of people they've had to wait for. So I really want them to leave feeling like we can start now. And often money is a big challenge with these patients, because of course, if they haven't worked for a long period of time or they've been working part-time, things, are tricky. So I'm a little bit more mindful of doing some of the testing that is self-funded, just in that initial period, knowing that it's probably, for many, been a big financial stretch.
Yep, and you might share more of that at your session at the symposium as well. And before we finish up today, can you tell us anybody who maybe inspires you or really, what makes you want to progress and do what you're doing and love what you're doing?
Oh, I could think of so many people in Australia, but I'm going to go with someone from overseas, because I always love and watch what he does, and that's Dr. Mark Hyman, who's from the Institute of Functional Medicine. He really inspired me, and also Dr. Jeffrey Bland. Like, they really inspired me with their thinking about functional medicine and the ideas of unpacking each case we see, not taking the label. Like, patients often come to the clinic, they book long COVID care and they've got long COVID for sure, but like they're perimenopausal or they're menopausal or they're depressed or they have an autoimmune disease. It's like a chicken or the egg. So don't take these things on face value and really delve deeply. And they're practitioners that always inspire me with their learnings, and being ahead of perhaps the game of what we sometimes see in our own practices. So I love watching those type of practitioners. But of course, there's a whole handfuls of inspiring people around Australia as well.
Oh, absolutely. And thank you for sharing that as well. So, the ATMS post-viral symposium is going to be on Sunday, the 15th of September in Sydney. And your session is going to be on naturopathic strategies for post-viral illness. I can't wait to see you in Sydney. And thank you so much for joining us today. But before we do finish up, if you can let us know where we can find you through social medias and your clinics as well again.
Yeah, so I'm Peninsula Herbal Dispensary and Long COVID Care, and you can find them both on Instagram and through the websites. But my personal Instagram, where I share lots of inspirational things that's happening in my clinic, but also my learnings, is at Carla Wrenn on Instagram, and you can find me on Facebook too.
Thank you so much again, Carla.
Thank you.